Diagnosing rectus abdominis diastasis is primarily clinical. Physicians look for the characteristic midline bulge and assess the separation between the rectus abdominis muscles. Imaging techniques such as ultrasound or MRI can be used to confirm the diagnosis in unclear cases, but they are generally not necessary. The clinical examination typically suffices as the condition presents with distinct physical findings. Moving on to management and treatment, the management of rectus abdominis diastasis is predominantly conservative. Since the condition often resolves on its own postpartum, observation and reassurance are the mainstays of treatment. Patients are advised on exercises that can help strengthen the abdominal muscles without increasing intra-abdominal pressure. Surgery is rarely needed and is usually considered only for cosmetic reasons or if the diastasis does not resolve naturally. It is important to note that interventions like abdominal binders are not recommended during pregnancy due to the potential risk of fetal growth restriction. Let's consider a case study to illustrate the typical presentation and management of rectus abdominis diastasis. A 32-year-old woman who recently gave birth to her second child visits her doctor with concerns about a bulge in her abdomen. She noticed the bulge when she was performing her daily exercises. Upon examination, her physician identifies a separation of the rectus abdominis muscles and confirms the diagnosis of rectus abdominis diastasis. Given that she has no pain or gastrointestinal symptoms, her doctor reassures her and advises her to follow a regimen of gentle abdominal exercises designed to improve muscle tone. Over the next few months, with regular exercise and careful monitoring, the patient's condition improves significantly and the bulge becomes less prominent. In summary, rectus abdominis diastasis is a condition that involves the weakening and separation of the rectus abdominis muscles. It commonly presents as a non-tender abdominal bulge, especially in pregnant or postpartum women. Diagnosis is typically clinical, and management is conservative, focusing on observation and reassurance. Surgery is reserved for cases where the diastasis does not resolve and is desired for cosmetic reasons. Early diagnosis and appropriate management are key to preventing unnecessary interventions and ensuring patient comfort. Thank you for joining us on Med Madness. Be sure to engage with our pre- and post-podcast quizzes and utilize the Anki flashcards for an effective study session. Until next time, stay curious and keep learning.